you end up hearing about hyperbaric therapy, or how did that get as part of the treatment program for you?
So we basically at Gloucester we have Johnny May, who's a big
Yeah.
advocate of it, and he, through Henshaw and their kind of chambers they do, he absolutely raves about it. He's very kind of professional in the sense that he'll do anything and everything to try and get that extra couple of percent, and he absolutely loves the chamber, and so he basically was saying how good they are and how I should get one, and then that's kind of when I opened those conversations, and that's when kind
Cool.
of YMU got involved and managed to grab one.
Fantastic. Yeah, I mean, it's really great that you have a great advocate on your team or on your with your program, because unfortunately not enough athletes know about these chambers and how well they can work to help optimize healing. Because one of the major things that you need when you're trying to heal is more oxygen. More oxygen lets the cells make more energy. It also helps with inflammation and with swelling, especially when you're doing it in like a full rehab context. Because you're not just getting into the chamber and like hoping for magic to happen. You're doing the rehab before, you're doing the rehab afterwards, you're doing the recovery. So it's fantastic.
Yeah. So obviously play rugby for Gloucester and Italy, as we touched on, but essentially been kind of professional as such for 4 years. And I was playing in Italy in the Autumn Nations Cup just kind of November time, and I kind of was just running, and I kind of the pitch slipped from underneath me, and my knee had basically bent inwards the way it shouldn't, and also kind of with the weight of my kind of the motion of me running, kind of fell outwards as well, and then obviously I heard the kind of the break, almost the snap, and immediately like kind of straight away pain, and then had that kind of scan. So it was a major kind of ligament rupture. It was the kind of the ACL, LCL, PCL damage, ruptured
The trifecta.
hamstring.
Congratulations.
Yeah, exactly. Thank you very much. Ruptured hamstring, fracture,
Wow. Okay.
and a torn calf as well for good
wow.
measure. So yeah.
Wow, for good measure. My goodness. Okay.
So
okay.
it was a major kind of, it was weird.
Your leg was
It's
still
not-
on. You still had your leg was still attached.
Just
okay. All right.
somehow
Okay.
it was still there, and then kind of had the scan, and then kind of worked out that essentially I had kind of nerve damage as well, so suffering from drop foot at the moment, which I've had a kind of more treatment on, more works on, but essentially still have that, but that's kind of where we're at the moment. It's obviously getting better. The knees, funny enough, completely kind of is great. We're kind of five months, maybe five, just touching 6 months post that big surgery, and yeah, the knees feeling great.
Oftentimes I get the question, well, how can hyperbaric therapy help? Can it help with this recovery time? Can it cut it in certain amounts of time? And the answer is that almost across the board, the answer has been yes. I mean, the question, of course, is how much time it's going to shave off. It's not completely clear. But the idea is that with all this oxygen in circulation, decreasing inflammation, getting more neurologic sort of blood flow in that area as well, in my experience, I've seen people have 50% faster recoveries. I've seen people have 70% faster recoveries. I've also seen people have 30% faster recoveries. Now, the younger you are and the healthier you are, which you would fall into that category before the accident or the injury, it's not an accident, it was, you were playing, so these things happen. The healthier you are, the faster people recover. And I think the real thing is consistency, doing it consistently, but also taking days off as well. So you don't want to do it every day. You do want to take at least one day off every week just to help recover and relax and be outside the chamber. So that's also important as well. And then over the long term, understanding what other kinds of tools and things that you're going to be using.